right, ladies and gentlemen, please, if you're still in the lounge, we're waiting for you. We're waiting for you so that we can begin in earnest. If you're still having your tea, we're waiting for you. Please make your way to the hall and have your seats so that we can begin in earnest. Thank you. All right, ladies and gentlemen, we're about to begin. If we could all just please settle down. Thank you very much for your time and, of course, for your esteemed presence. We sincerely appreciate you. All right, distinguished ladies and gentlemen, esteemed guests, stakeholders in the Nigerian healthcare sector, good morning. Good morning, distinguished ladies and gentlemen. Thank you very much. Thank you once again for your time, for your presence. We understand your very busy schedules, and of course, there are many different places that you could be other than this place, but you're here today, and we sincerely appreciate that. Thank you. You're warmly welcome to the launch of the report titled Frontline Health Facilities in Nigeria, written by Dr. Femi Olugbile in collaboration with BusinessDay Media. This event is intended to spotlight many health facilities across Nigeria that are providing quality, specialized health services. But beyond that, it's also to serve as a launchpad to catalyze important discussions on policy decisions, as well as the need for capacity building for healthcare services across Nigeria. Throughout the course of this event, ladies and gentlemen, from the opening remarks to the keynote speech, and of course to the panel session, I urge you to keep an open mind as we discuss Nigeria's journey to a world-class healthcare system. Are we really on track? Please keep an open mind. Ladies and gentlemen, my name is Zainab Aderomu. I'm a business journalist at BusinessDay. And once again, I warmly welcome you to the launch of the healthcare facilities in Nigeria. Please, a round of applause for yourselves. Thank you. Now, to kickstart this event, I'm going to be recognizing some of our guests who are in the house. I would recognize one person now, but of course, as the event goes by, I would be recognizing more special guests. Please join me as I recognize the esteemed presence of the Special Advisor to the Lagos State Governor on Health, Mrs. Kemi Oguyemi. All right, please also join me as I recognize the esteemed presence of the CEO of Marcel Ruth Cancer Center and Specialist Hospital, Mrs. Modukbe Elebute Odunsin. We also have with us the Chief Medical Director of the Lagos State University Teaching Hospital, Professor Adetokunbo Fabanwo. Oh, Fabanwo. Thank you for your presence, sir. We sincerely appreciate you. We also have with us the CEO of Iwosan Lagoon Hospital, Dr. Oluwatomi Kogo. I hope I got that correctly. Okay, all right, the MD. A round of applause, please. Welcome. We also have the Managing Director of St. Nicholas Hospital, Dr. Dakbo Majekodumi. You're most welcome, sir. We sincerely appreciate you. We also have the representative from St. Ives Hospital. All right, let's also welcome the representative from St. Ives Hospital. Please, if you could just signal your presence so that we can appreciate you. All right, please a round of applause for them, ladies and gentlemen. We also have the Country Director of Pharmacists Nigeria, Mrs. Injide Indili. A round of applause. You're most welcome, ma'am. Okay, let's also welcome the representatives from Association of Private Practitioners in Nigeria. All right, let's also welcome the representatives from the ANPM, that's the Association of Private Practitioners in Nigeria, please. If we could just see, thank you very much. Please a round of applause for you. All right, thank you very much, ladies and gentlemen. Of course, if we have more special guests, we're going to be recognizing their esteemed presence because that's very important. But of course, to kickstart this event in earnest, we will be listening to the opening remarks / welcome address from the publisher of BusinessDay Media. Ladies and gentlemen, with a resounding applause, please let's welcome Mr. Frank Aibogun. We can make the applause louder than that. Thank you.
Thank you, Zainab. I think it was easy to call me Mr. Frank Aibogun because that's who I am. We struggled at the beginning when she addressed doctors as Mrs. And I said, okay, that's fine, because at BusinessDay we call everybody Mr. or Mrs. But when she then started with a professor, I think she should have, I said, okay, that's fine. And then as she went on, she introduced doctor as well. So we're sorry for the omission. Ladies and gentlemen, let me join in welcoming you warmly to this morning's event and to offer a profuse apology for the delayed start. I understand traffic has been horrendous, and I think it's been so for a while. I'm not exactly sure whether we can use this as a proxy for measuring the health of the economy, because as tough as people say the economy has been, the rush for Christmas has also caught up with all of us, and I haven't seen any drop in pre-Christmas activity from last year. So perhaps when it's raining, it's probably just raining where you are. Others are probably experiencing the sunshine somewhere. But anyway, welcome, truly welcome. We have a very small task this morning, and it's to listen to some of you and then, of course, make a public presentation of the 2024 Health Facilities Report. We're very excited. And before I go on, because again, I noticed that my colleague had omitted the presence of Dr. Femi Olugbele and the wife, so let me just Let me just ask that they both take the applause. Femi has been writing for us for quite a while. When I was editor of the Vanguard in the 90s, he did a write for the Vanguard as well. And I was so grateful that he chose to move when we started Business Day. But that's not when I first met Dr. Olugbile. Soon after we got married in 1988, my wife developed some regular headache. And he then was working for Echo Hotel at the Echo Hospital. Because I'm in the hotel, maybe that's why I said Echo Hotel. And it was the, I don't know whatever happened to the outlet they had in Surulere. And that was where I first met Dr. Olugbile. So this has been coming from way, way back. And I must thank you so much, Doctor, because my wife has been in good health ever since. Thank you very much. Thank you. We make the mistake of thinking that you just write very well. I think you do other things very well as well. Thank you, sir. We won't spend so much time. We will very briskly go through that which we have to do this morning. But let me just provide some perspective, some background to this. And I said to some of our guests who had come earlier that it is not in all sectors of the Nigerian society that we see good things happening. And in truth, it is not because you are here, you stakeholders in the health sector. I think there has been virtually all round great things happening in the health sector. I have an elderly friend who is very well endowed and very organized. If I ask him now about his travel for next year, he's bought all his tickets for next year. He's very organized. Late last year to early this year, two things happened. He had an emergency. To my greatest and pleasant surprise, he stayed here not only for the diagnosis, he also stayed here for the treatment. I wouldn't mention the hospitals. This fellow, if he had headache before, he wouldn't stay. Headache. The wife did surgery on both knees here in Lagos. It's a measure of the confidence that even those with means have in the improvement in the health sector in Nigeria. So I'd like to congratulate all of you for the great things that are happening truly. The facilities that have been opened, facilities that have been upgraded, the funding and the magnitude of funding that is going into healthcare in Nigeria. We indeed appreciate that work. And we see that as this happens, some people know and many others in Nigeria don't know. And one of the reasons why we are here this morning is to begin to catalyze the work that is required to put more light on the great things that are happening in the health sector, so we can begin to talk more about it, but also more importantly, in resource deployment, so we can show our priorities. I believe that the healthcare sector needs more patient capital than it is getting at the moment. So my hope is that government can not only talk about it, but government can, through policy formulation, actually redirect considerable amount of resources to fast-tracking the work that is already going on. And it's not just the money. We're also seeing groups that are helping to attract Nigerians from abroad who probably come in for just one case, deal with it, and they fly back. Or they come in for several cases, they deal with it and come back. Or come in and also serve different hospitals, they deal with it and they go back. All of this, in my view, will get Nigeria to the point where we do not only think about conservative foreign exchange that is today spent on the so-called health tourism. But we then become recipient of health tourism dollars as well. Now we have over several months with the leadership of Dr. Olugbile worked on this report, which we will be showcasing at some point later. It is the culmination of the work of a number of people, including some of my colleagues who are not here this morning. We are indeed very proud of the work that Dr. Olugbile has led. And I'm sure when you get your hand on a copy of the report later, you will acknowledge that work, excellent work that has gone on. My task this morning truly is to welcome you all, and I welcome you warmly once again, and to offer Business Day's hand in partnership. We seek to indeed engage with sectors to better understand the dynamics and how the trends are evolving. We seek to understand their needs in terms of what the priorities should be in our coverage. And we want to believe that we would have great health facilities that are great not just in the quality of the service offered, but are also great as healthy, prosperous businesses as well. It's so important that that is the case if we want to have a sustainable healthcare sector. And so our desire would be to see that some of the pain, needless pain that is, I don't have a problem if you're a doctor and you're in the middle of the night and they call you to come and perform a surgery. That pain you have to take, that's the job. But the needless pain of driving to the hospital and then the policeman stops you and is delaying you, and then you get there, there's no light, you're asking them to put on the generator, and you're now thinking of how much a liter of diesel is before you think of the patient that you have come to see. Those are the kind of pains that we think we need to work to take out. Once again, ladies and gentlemen, welcome, and I need to let you know that this event is being streamed live on Business Day Television via our YouTube channel. I hope we have a great time this morning. And let me end by welcoming very warmly the Special Assistant on Health Care to Mr. Governor. Thank you so much, Madam Kemi. Let's enjoy ourselves. I'm sure some of you will be meeting some friends that you haven't met in a while. This opportunity provides this meeting provides that opportunity. But if there are questions, if there's anything, I'd like to meet as many of you who are here as possible. So truly, the partnership we seek, we can get going with it. Once again, welcome, and I pledge we won't be keeping you for too long this morning. Thank you so much for coming.
Thank you very much, ladies and gentlemen. Thank you very much, sir. That was the publisher of Business Day, Mr. Frank Igbogun. Another round of applause for him, ladies and gentlemen. Thank you. Next, we'll be moving to a most important aspect of today's event, which is the keynote speech. And our keynote speaker is also the author of the report, of course, in collaboration with Business Day. He's a seasoned health administrator and a prolific essayist. He's also the CEO of Synthesis Consultants. Dr. Femi Olugbile has served as a permanent secretary to the Lagos State Ministry of Health from 2010 to 2014, and also as the chief medical director of the Lagos State University Teaching Hospital from 2001 to 2010. He has authored 7 groundbreaking books ranging across different topics from health to fiction, and has published in many reputable academic journals. Dr. Femi Olugbile is also a columnist with Business Day. With a resounding applause, ladies and gentlemen, please let's make welcome Dr. Femi Olugbile. Let's keep clapping until he gets here. Let's keep clapping until he gets here. Thank you, sir.
Distinguished ladies and gentlemen, I can't begin to tell you how delighted I am to be here this morning. But first of all, I would like to, as they say, stand on the existing protocol. Hopefully, it's a platform that will not shake or crumble, because it's been established by somebody, a man of several competencies, including public speaking, but also innovative publishing. Okay, that took him from the innovative publishing and journalism that took him from the vanguard stable to establish his own niche and create a business-focused stable. But in standing on those protocols, I crave everybody's indulgence to recognize my special egmo here, the Ogbeni Oja of Ijebuland. That's Dr. S.F. Kuku. There's a self-preservative element to my choice of singling him out for recognition. I occasionally have to travel along the Ijebu route because I come from Ijebu-Igbo, and if you are not on good terms with the Ogbeni Oja, and the Ogbeni Oja has nothing to do with Oja, it is really, but that's another story. You'd better be on the good side of Ogbeni Oja so I can travel safely and comfortably through that route. It comes also from a dynasty that is preeminent, the dynasty of the late and great Chief Kuku. I have a story about Chief Kuku, which I intended to clear with my Igbo, but I just want to put it out raw, just to show you how things swing occasionally in history and great historical events develop. I understand that when a lot of proselytizing was going on in that area, some Christian missionaries went to that zone and tried to proselytize and win converts. And there was one very, very powerful warlord whom I will not name, who felt an affinity to their message and was going to join them and take his followers, who numbered in the thousands, along with him. But there was one snag. Those people insisted that people should have only one wife. It was as part of their understanding of their doctrine. And that was a major issue. And they discussed it, they couldn't resolve it. Then another camp and another religion came immediately after. And I heard the same day or a few days after, that powerful warlord and trade leader with all of his huge numbers went to that other camp, and that has become the established religion of that preeminent clan in Ijebu land to the present day. As I've said, I put no names, and I will later try to verify my sources from the sources. Thank you very much. Thank you very much, sir. I have a few words to say. It's not really a keynote address. I look on it more. What I've titled this as a question: why frontline health facilities in Nigeria? And it's really a question. So it's a question. The title of the book we are presenting is Frontline Health Facilities in Nigeria. So I'm asking, why is that title chosen, and why is there a necessity to even think along those lines at all? And I've tagged on to that a few explanatory notes on the book from the author. In April 2021, in collaboration with BusinessDay, we published a document titled The Business of Healthcare in Lagos, 20 Frontline Hospitals. The point of the exercise was twofold: to find out how durable and successful the healthcare industry was in the Lagos environment as a business prospect, what we called the business of medicine, and also to go beyond the glossy facades of hospitals and healthcare facilities and to attempt to look at what they were actually doing from a quality perspective and from the perspective of the users of the services. Inputs which we felt were critical and were often neglected in assessing or in evaluating or reporting about health facilities. This was at a time when Nigeria was trying to recover from the effects of a COVID-19 pandemic, which has stretched society's resources almost to breaking point. We selected facilities that enjoyed the highest public esteem or that were measured as top tier by regulators. We did a deep dive into each one, looking not just at their physical structures, but at the content and impact of their operations. One of the major things we looked for was the presence of a formal quality improvement structure and process, and or the possession of a formal quality accreditation from a certified accrediting body, whether local or international. The positive reception our publication got among the healthcare community and the impetus the exercise appeared to give towards increased incorporation of quality improvement into facility practice has led us to a decision to take the microscope of examination beyond the borders of Lagos State and attempt to focus it on the entirety of the Nigerian Federation. This time, the emphasis has been changed from hospitals to health facilities in order to accommodate a realistically expanded definition of the healthcare team, which nowadays includes hospitals, pharmacies, diagnostic facilities, ICT and engineering, social welfare, and various other stakeholders. It has proved a tough assignment, deploying a large team of field workers made up of journalists from BusinessDay stable in different zones of the country out at once. From an initial survey of user options and other criteria, a list of eligible facilities was compiled. These were visited and observed by the field staff and the chief executives interviewed. They filled out questionnaires which provided such details as history of the facility, scope of services, personnel and equipment, client feedback mechanisms, quality improvement structures and processes, if any, accreditation and development plans. The result of our work is the book that we are here to present. It is not an award system. It is not an effort to rank hospitals or to make any statements about who has the most specialized and expensive equipment for carrying out cutting-edge interventions in various areas, or which facilities have the 5-star hotel facilities, although we have come across a good number of such. While we establish the basics concerning quality accreditation, an increasing number of Nigerian facilities are getting quality accreditation or beginning the process, but a large number are yet to get the message, or at least a commitment towards continuous improvement with standardization and measurement in processes and practices. We look closely for relevance and impact of a facility on its area of location. Modern health facilities are sadly not evenly spread across the nation of Nigeria, nor are they likely to be in the foreseeable future, realistically. A previous president of this great nation once spoke of a desire to have 6 privately funded world-class hospitals, with one in each of the 6 geopolitical zones of Nigeria. This may not be feasible or operationally sustainable. In our view, our findings show that the most modern facilities tend to be clustered in urban areas, in specific areas such as Lagos, Abuja, and Port Harcourt. But the absence of a glossy so-called world-class hospital from a zone is not always an incurable disadvantage, as it occasionally may inspire dynamic and determined health workers and administrators in a locality to drive a facility to rise and shine, and to provide excellent services to the public, to provide training for a wide range of residents in various specialties and get them to secure excellent results in their postgraduate studies, and as well as reaching down and providing supervision for the workers in their locality in their primary healthcare facilities. This creates confidence in staff and patients at the PHC level while reducing the traffic of unnecessary cases to the specialist hospitals. Such is the story that we found at the Ahaf Specialist Hospital, the acronym DASH, in Lafia, Nasarawa State, which is among the 38 facilities that are highlighted in this book. Just as a point of history, shortly after our team discovered DASH, we received the news that it was to be taken over by the federal government and, in quotes, promoted to the status of a teaching hospital, providing a training environment for medical students from a nearby medical school. In effect, this unique hospital will be doing what it already has been doing for several years, hopefully with more personnel, equipment, and financial resources. So in punching above their weight, they achieved great relevance in their environment, great impact on the lives of the people, and beyond the gloss, without the gloss, they were doing what a good health facility, a good modern health facility, we think in this environment and this country should be doing. In the 90 or so pages of this book, we are taking a close look at selected medical and diagnostic facilities across Nigeria. Each one represents unique value for its environment, which should be easy for the reader to discern. They range from a PHC boosted to international recognition through a community-based health insurance scheme fostered by an oil major, to a general hospital providing sterling services under a unique public-private management arrangement with a private operator, and also to a private teaching hospital with cutting-edge resources, which is training neurosurgeons for Nigeria. I'm talking about a private neurosurgery teaching hospital. There are mega hospitals which are part of international chains. There is the first interventional cardiology unit in Nigeria, which is still waxing strong, and the country's largest cancer center, which is also a center for treatment, trials, and research in cancer. On the other hand, there is an expensively built and very well-equipped public hospital in one state, which the state obviously cannot afford to run at the level that will do justice to its installed capacity. And again, we feel that part of what an effort like this is meant to do is to highlight this. So we are not just highlighting actual successes, but potential within reach successes. This is not, that's why I say it's not a celebration. Sometimes it is a call to action. There is, of course, the country's first facility to receive JCI accreditation, the gold standard for quality. Crucial basic issues are discussed in the preamble. Nigeria needs an efficient system to garner accurate birth and death statistics. We do not have accurate birth and death statistics in 2024. And that is a terrible failure. We are not alone in it, so we can rationalize that we are not the worst in Africa. Well, that doesn't say anything. You can't really run good hospital practice or good healthcare at all when you don't know the numbers of people, of children that are born on a daily basis, where they are born and in what circumstances, and you don't know the number of people who die or why they die. There is a coronal system in Lagos. There is some vague effort at doing the necessaries also within the Nigerian Constitution. But I can tell you that even in Lagos, are supposed to be the outlier in the field. The observation of the coroner's requirements are in the breach more than in the implementation. Whatever estimates we have about causes of birth, causes of death, are guesstimates at best. Many people die due to mysterious causes. Many people die due to criminal causes that are never identified. And that, for a great nation like Nigeria, and for a nation that has reached the level that it has reached, both physically and aspirationally in terms of development of resources, it is something that we say, because all the requirements that we have to get these things are actually there. Take birth registration. People are, technically, everybody is supposed to be born in a hospital and they get documented there. The birth certificates are unfortunately not issued in the hospitals where they are born. But there's also another snag. Many of our births are not taking place in hospitals anyway, or now many of the people don't deliver attended by trained Professor Bafabawo's professional category has a name for them. They call them no, those are the people who birth them. The basic requirement is that people should be attended by a trained birth attendant or a trained person, somebody who is officially trained. So many people are born who are not who don't fulfill that category, so they don't get into the system. People go to register their children maybe when they want to get services from the state, when they want to register them for children 5 years after they are for school, several years after they are born, or when they are offered sweeteners, or when UNICEF or some other agency offers sweeteners, and then the population, the people who work under the population commission in different offices, then go out into the marketplaces at Okeane and say, I register and it's a ragged process that does not even begin to approximate to the truth. And if that is Lagos, then you can imagine what is happening in the rest of the country. We need to capture this low-hanging fruit so that the high flyers that we have in this room and the entities that they represent can really fly with confidence. There are conversations in the book with experts on how to make compulsory health insurance effective in order to achieve universal health coverage. Technically, Nigeria now has compulsory health insurance is compulsory, just like it is compulsory in Lagos State. How to implement that and actually translate it into figures of people who are actually registered. Like in Rwanda, Rwanda has 90% compliance. 90% of the population of Rwanda have health insurance, no matter how basic it is. If you got anywhere near those numbers, these hospitals that we are celebrating will function much better. Because, first of all, they'll be doing numbers of clients. One of the things we discover in the book is that some people with high personnel and equipment resources get very little traffic. Maybe you are able to, there are people with there could be a unit with the competence to do 100 cases of X unique thing every week, and they get to do 5. Private sector participation in the business of health and the inevitability of Nigeria becoming a hub of medical tourism become crystal clear in the course of going through the book. We've been talking about it for several years. We are getting impressionistic accounts of people, just like the one given by the publisher about his friend who trusts the service and has benefited from it, and the wife has done knee replacements here. We are getting individual impressionistic accounts. We are going to, in very short order, begin to actually get numbers that show a trend, because that's where we are, that's where we are heading, and there's no going back. But some loose ends need to be tied up. At the end, a book like this can only skim the surface. As the saying goes, and as I'm sure you will say, more is left out than what is included. There's a lot of energy currently in the health sector of Nigeria. A few days ago, and outside of the reach of the information gathering for this book, the governor of Lagos State, and I'm happy the special advisor is here. I acknowledge you finally. Thank you. The governor of Lagos State did this turning of the sword, or was it, what is the ceremony called? Whatever. The groundbreaking for a project that has been in the works and in discussion in Lagos for over 10 years. And it's going to be a very major thing. Not just in terms of the numbers it's going to do, 140 beds, multi-specialty, and all of that. 20% of the people, of the patients, of the beds are going to be used for treating Lagosians free of charge. Okay, and high-end activities across the range of medical specialties will be done with the in-stock apart. It's coming out. A report on it is coming out in my column on Friday, incidentally, in BusinessDay. So things are happening, and it takes a lot of confidence, both from the private sector and the government, for people to be doing that, despite all the cry about the economic difficulties Nigerians are having and the challenges, and the very real problem of how to get your money back. Dr. Wajekodumo, I'm sure, spends a lot of his money agitating about how to get money back from he has the largest, his hospital has the largest profile of successfully done renal transplants in I believe in West Africa, or maybe it's a larger region. Certainly in Nigeria, it's beyond the reach of Nigeria. And that activity costs in the millions of naira. But even he and his team could be doing more than they are doing. There's a barrier at the door, which is how will people access the funding? Yeah, the village people can contribute. The company can sponsor, but for everyone that is done, there are large numbers that are left undone and left to their own resources, maybe to waste away, to die, or whatever. So we have to match the size of our burden with the actual use of our capacity. And even that capacity that is still not sufficient to match our numbers is not fully utilized for economic reasons. And that reduces the sustainability of the high-end facilities themselves. So it works all the way around. If you are doing fewer cases or doing fewer interventions than you are equipped to do, your specialists are not as sharp as they should be, because they need that traffic to keep their, if you are doing open heart surgery, you need a certain number of cases to do, to even keep your skills at an appropriate level. So if you are doing under those numbers, it's not economical for the entity, it's not good for you as a practitioner, it's not good for the society, because for everyone you are doing, hundreds of others are out in society and they're dying because they cannot access it. So we are all suffering because we need to do a few more things to integrate even the things that we already have, which are significant and which we are not where we started from. We are getting to be in a good place, and we should acknowledge that. And I think that is the point of this. We are not yet there, as in having arrived at a first world level, but we are not where we started from. We are in a good place, and we can only sustain ourselves there by pushing forward. At the end, a book like this, as I've said, can only skim the surface. I've talked about the medical back. Just a few weeks ago, I discovered that there's a unique facility in Lekki, which is an ultra-specialist reference hospital for sick premature babies. That means we're having a facility that is dedicated just to prematurity, which is it looks like a small niche, but if you count, 600,000 babies are born in Lagos, by calculation, every year. Out of that, a significant percentage, especially because we now have a lot of IVF centers that are one of the fallout of having IVF practice, a rush of IVF practices in Nigeria, is that a large number of premature, multiple births are being born, and so a significant percentage of those are premature, and they need special facilities. So many of them die, unfortunately. Or many of them, you have 6 and 3 survive or something. So this hospital actually caters to the needs of those 3 that would have died. And it's very unique, and it's very hard to sustain if we do not tie the ends together. So you might hear next year that the place has closed down because of poor traffic. Not because there's no need, but because we have not integrated our services. There's plenty of space for building specialist centers around niche competencies to render unique services. An example of such a single specialty practice that is having tremendous impact is, for instance, Next Hematology Hospital, Surulere, which is also featured in this book, and which offers FRSs and other specialized services for patients with sickle cell diseases and hematological conditions. Tiny cottage boutique place. But people come from all over, from the glossy centers, because it's a unique niche thing that they have honed the competencies and acquired the equipment and ability to do. Everyone may reach their own conclusion going forward after going through the 2024 iteration of our book. And the implication is that the picture will continue to change over the years as some new entities raise their game and as some new entrants come to disrupt the space. My own conclusion is that the future is very bright for Nigerian medicine, but a number of gaps need to be plugged, as I've said up the cuff, and a number of threads that are hanging loose need to be tied together so that we can have a coherent and functioning and sustainable system. So hospitals are not being established and then closing down or running down, because they cannot afford the cost. You start off with 1,000 competencies and you whittle down to 50 because of the sustainability issue. It's a continuous exercise, and even the very fact of putting this out in the public space is meant to disrupt in a way and get people to start to think in a different direction. As I've said, it's not a rating system. It is not an award system. It's just a way of challenging. So when anybody comes along and says, I should be there, it's a challenge. And we are, as we go out, already by the very fact of calling this a 2024 report, it means quite possibly there will be 2025 or 2026. It's a process that we think should have a self-sustaining value of its own, and that represents value for the industry itself, because people can be still, okay, what are the things that are good? Quality, whatever, documentation, and it helps everybody in the end. I thank you for listening, and I wish everybody a very good morning.
Thank you very much, sir. Thank you very much. Ladies and gentlemen, I believe that the applause can be louder than that. Let's give Dr. Olubile another round of applause. Thank you. You know, it's a thing to celebrate that there are healthcare facilities in Nigeria that actually provide specialized services and quality services at that. But it's also a call to action, like Dr. Olugbile mentioned, of how we can bridge the gaps that still exist within the healthcare sectors. And I believe that's why we are gathered here today, to discuss and also to find actionable solutions. So we'll be moving very quickly to the goodwill messages, but before we go into the goodwill messages, I'd like to recognize some of our special guests who joined us while he was delivering his address. Please, with a resounding applause, let's welcome the presence of Dr. Sonny Folorunso Kuku, a master physician and endocrinologist, a renowned scholar, and of course an administrator. A round of applause, ladies and gentlemen. You're most welcome, sir. Let's also welcome the presence of the Director of the Nigerian Sovereign Investment Authority of the Lagos University Teaching Hospital Cancer Center, also representative of the Private Sector Health Alliance of Nigeria, Dr. Lillian Ekpo. You're most welcome, ma'am. Thank you very much for joining us. Let's also recognize the presence of the head of corporate services of the Eye Foundation Hospital, Mrs. Abimbola Olusoya. Apologies for that, Mr. Abimbola Olusoya. We also have the presence of the head of business development of Evercare Hospital, Lekki, Mr. Toyib Olatunji. You're most welcome. Let's also welcome the manager, marketing and communications of Evercare Hospital, Lekki, Mrs. Choma Ewereji Ogbongda. I hope I got that correctly. You're most welcome. And finally, Mrs. Olabisi Agbaje from Crown Hospital. You're most welcome. Thank you very much. We sincerely appreciate your esteemed presence. And now to the goodwill messages. I have the honor to welcome to the stage our first doctor to be delivering the goodwill message today, Dr. Sonny Folorunso Kuku, master physician, endocrinologist, and renowned scholar and administrator. Ladies and gentlemen, a resounding applause for Dr. SF Kuku. Thank you.
Ladies and gentlemen, from all sectors of the health sector, all areas of the health sector, in particular, Dr. Olugbile, who I don't know whether he missed the road or the road missed him, because he's proven to be even as expert in writing as he's an expert in psychiatry. And I knew him as a psychiatrist, and I knew him as a first-class psychiatrist. And he was one of the people who built Eko Hospital Psychiatric Unit before he moved to greener pastures. And but that is a man who is restless. That wasn't enough for him. And he keeps writing and pointing out a lot of important things, and we thank God for him. This book by Dr. Olugbile with cooperation of BusinessDay, like he said, is not really a league table. It's not got to do with being in the Premier League. It's just an example of what has happened in the last few years. And the various hospitals have started in different ways. The St. Nicholases of this world are the forerunners, but they started as a niche hospital for the well-endowed, for the rich. Don't mind that, don't mind what I'm saying about you, but it's true. But because it was fashionable then to go to St. Nicholas. And St. Nicholas didn't need to do much because the general hospitals and the teaching hospitals were doing well. They were doing so they could have that elitist look. But then problems started when the teaching hospitals started going down. And St. Nicholas had to up their game. And then some tsunami also occurred. And great teachers and so on moved into the private sector in a way, in a totally different way that never occurred. That is specialty practice in a hospital. And built probably the first purpose-built hospital in Nigeria, and brought in tertiary experience into it. And so things were beginning to move in that way. And then came this very famous Eco Hospital, very, very famous. Don't mind St. Nicholas and Lagoon, don't mind them, Anyway, this started really as an offshoot of certain things that were going on at that point. The government drove away the specialists from the teaching hospitals to go set up. And many people knew that nothing was happening in teaching hospitals, and then they set up. And when this happened, some groups started, which were actually, I remember the medical consultant group, which had the surgeon and the physician and the gynecologist and all, and they practiced, and they had really no place to admit people to at that level. And at that time, St. Nicholas used to play that role. People go there, but it's not everybody really who could go to such hospitals. Anyway, then with that little push, many other people then started group practices, like Eco Hospital, but then eventually changed. One thing that people don't know about a place like Eco Hospital, which Dr. Olugbele would confirm, and I don't know what in psychiatry you call this confession and disclosures, and so I won't say too much. But when that happened, we then have people of tertiary background, like the Elebutes and co, going into practice. And therefore, not just setting up a hospital, but from the start, starting hospitals at a tertiary level. And when that occurred, you then had situations in which you had specialties in the hospitals. That is, they became a one-stop center. And St. Nicholas very quickly moved up to that level. Isn't that so? Yeah, they knew they had competition, and then before we knew, some high-rise came up and beautiful settings came up, and anyway, whatever it is. Okay, I have 20 minutes. How can a lady come and tell your Benyoja when to stop? Anyway, let me just round up that a lot of beautiful things are happening now, but the only way that we survive is the healthcare financing. Dr. Lugbele mentioned it. Until health insurance becomes compulsory. Or there's another way, which I don't think would happen in Nigeria, in which a percentage of the budget, whether it is agreed upon by the parliament or not, say 5% of the budget goes into care, like the NHIS, like the NHS in England. Until that happens, everybody's going to beat about the bush. nobody will be able to afford what is going on. It's not possible. It's not possible. So if we want universal health care, what we need is free or third-party payments. And the first step is what has happened, that is make it compulsory. It took political will for that to be signed a few years ago. When it was started, Abacha and Co said, no way, it cannot be compulsory because God against Sharia and all kinds of things. But now, if from this book we can learn the fact that various people have started monospecialist hospitals, multiple specialty hospitals, but realize that the only way to fund it, all these beautiful Harvard Medical School, UCH in England, they all depend on NHIS funding or health insurance funding. If we can surmount that, then everybody, the hospitals will thrive. But for as long as we are getting 70, 80% people paying out of pocket, in fact, if you say 70, 80%, I think it's even low. Because I don't think third-party payments cover more than 2 or 3% of the population. So I would advise the new hospitals who have put some, to please just hang on there. As long as we can push that health insurance or a different payment system where somebody else pays, something good will happen. And I'm very proud of what's going on in Nigeria. And Dr. Lukbile, once more, fantastic work. And keep on writing. You may make more money from that than medicals. Thank you.
Thank you very much, sir. Please let's make the applause louder. If we're clapping, we can do it better. Thank you very much. All right, so we're going to welcome the next doctor to give the goodwill message. Please note that we have just about 2 minutes for that. Ladies and gentlemen, please welcome on stage the Special Advisor to the Governor on Health, Dr. Kemi Ogunyemi. A round of applause.
Good morning, everybody. I'll stand on the existing protocol that was established. I'm glad I'm here. I'm glad I was invited, even though it was only yesterday. And I actually was supposed to have left about 30 minutes ago, but I sent a message because I just got interested in, it's like, I'd like to read this book. I can't wait to read it, especially when it's coming from somebody who's actually worked in government for so long. So that perspective will be very, very interesting. But as you were talking, I did take some notes. You know, from the part of government, if you look at Mr. Governor's Themes Plus agenda, the whole idea of health is to ensure that the people get affordable, accessible, quality health. And we know as a government, especially in this health sector, that we cannot do it alone. It's not even possible, any way you look at it. But the ideas are good. But it is about money. Health is business. It's not, when you say it's not all about money, yes, it's a, compassionate job. You can do some things for freebie, even though lawyers don't do anything for freebie, but doctors and nurses is, freebie. But without money, you can't do anything, whether it's infrastructure, whether it's paying people welfare and good salaries and all that. And we recognize that in government. And that is why Mr. Governor does a lot of PPP, that's public-private partnership, because we cannot do it alone. Look at LASUTH alone. LASUTH is our only tertiary hospital. And I'm not just saying that because Professor Famawu is here, who's doing a fantastic job as a CMD. But if you go there, you see that we have a lot of PPP. We have a lot of diagnostic things that would not ordinarily have afforded by government alone, because there's a limit. And Lagos, and I can only speak about Lagos, and I know this is Nigeria as a whole. But if you even look at Lagos, that everybody looks up to that, if Lagos does this, and we are a center of excellence, and that when we cough, people sneeze, they copy us, all the partners come, and it is true, all the international partners, anytime they want to pick states, they will always pick Lagos. But why? The smallest state is so densely populated, so many people coming in, people, just pulling here and there and all that. Her Pharma is here. 60% of our patients actually go to private practice. And I can tell you that Her Pharma, as an agency that gives accreditation to hospitals, cannot go to every single hospital. Not only do we not have resources, but we have so many hospitals. So many. And there's so many small ones as well. And they're all general hospitals. They're all, want to say, like, I don't want to, now that you're streaming it, I have to be careful with my words, but they're not practicing correctly, properly. And we always rely on the public to tell us so that we can go there, shut them down if they do not have accreditation, or ensure that they have all the things that they have. I'm saying that because these frontline health facilities, yes, they're probably big, they're the ones people know, they're the ones people go to, they're the ones that kind of like have it, but they also have to have a certain type of standard that government wants. And that's basically that it's not just general hospitals we want specialists. And you've mentioned it. That's why I said you're in government and you know what the issue is. Specialized care is what is lacking in Nigeria as a whole. Otherwise, why should people come from the north to come to Marcel Ruth Cancer Center, all the way from Kano, all the way from Kaduna, and they pass all those states to come down south to Lagos, because Lagos is the one that has them. And so we as a government, when I say PPP, we're trying to, all the people coming, and by the way, there are lots of doctors coming back, just coming back to say, I want to set up, I want to do this, I want to do that. They come to us, they come to the office. And the problem we have also is that, is the environment conducive for them? Lights and all the things that you've mentioned. So it's not an enabling environment as such. So they stick to hospitals that are already established, and then they come in there, they do their work, and then they go back. And that hence comes Medipac that you talked about, that we did the groundbreaking a few days ago. That's the whole idea of having this, not only a hospital, but also units where people can actually have their practice. And so it becomes a whole new community, a health community for people to, and it's a dear project to Mr. Governor, who really wants to, even if it's the phase 1 that is started, and we have a lot of investors. You talked about health insurance. It is mandatory. It's an executive order now. We are looking at how we're going to enforce it. All the public servants, civil servants, now get the money deducted from their salary, and they've been doing that for a while, actually, not just now. But how are we going to enforce it? We have so many programs. Everybody likes freebie in Nigeria, in Lagos especially. Anything free, they come, but somebody's paying for that free. So one of the things in Lagos State is that if you're not even registered with LASRA, you're not even going to get access to anything that we're doing. And if now we're going to go into, if you do not have insurance, you're not even going to get it. It doesn't matter whether you have private insurance, it doesn't affect that, but you do. It is compulsory in Lagos. So if any of you do not have it's not Alafeco, sorry, Ilere-Eko. Alafeco was a program we did where we gave everything basically free. But if you do not have Ilere-Eko, there's some things you're just not going to be able to do. There's some things you will probably not be able to buy land. You probably will not be able to get building permission on certain things. So we have our ways of ensuring that everybody has Ilere-Eko. And if you're employing people, it's actually good for you to give them health insurance. That's free health insurance for them, but you have to pay for it. And that way we make sure that everybody has insurance, which is very, very important to get universal health coverage. We talked about, I want to go back to LASUTH as well. You were talking about if you have a lot of human resources and people that can do the work, but you do not have the traffic, LASUTH has the traffic. In fact, they do a lot of groundbreaking, and I'm not going to Rob, I don't know if Professor Farmer was going to talk, but I'm sure he's going to want to tell you about what he's doing in LASUTH, which he always proudly does. Regarding, I just want to pick one more thing, regarding population census, actually UNICEF, you're very right, UNICEF is actually, let me say, it's a joint, it's a fund, because we're paying as well and they're paying. We're actually e-registering births. Right now, we have 450,000 new babies registered so far. The target is 600,000. Now, that came from the National Population Census. And we're trying to encourage the traditional birth attendants that when you deliver, because they're still going there, but so we have a dialogue with them. just come to the hospital and we'll register, and it's e-registration. So as soon as people are born, whether it's island maternity or whatever, they are registered electronically. And that way we're trying to see how we can count. And it started about maybe less than a month ago. We have 450 already registered E. Data is very, very difficult, as Dr. Olugbile has already mentioned. But I'm not going to talk for too long, but I'm really, really interested in reading this. Yes, it's 2024. Maybe there's a Frontline health facility in Nigeria in 2024, because I can tell you for nothing, by 2025, I'm sure there'll be more. And you're right, we're not going to look at it as, oh, this is the best, that one is the best, that one is not the best. It will be a very interesting read. I hope I can get some insight into some things I never even knew, so that we can actually make policy. So when we're in cabinet, it's something I can bring up to Mr. Governor and say, actually, there's this, and of course he knows you. So it's a credible, and of course BusinessDay, credible sources, very, very important to know who wrote it. Are they biased? Are they not biased? And all that. So thank you so much for that. I'm looking forward to reading it, and I'm sure I'm going to be in touch with you to ask some things. I will also tell the Commissioner, Professor Bayomi, to read it as well, since we're both there in Cabinet. So apart from all that, congratulations on this BusinessDay, and Dr. Olugbile, really, really good. It's about time. We are moving. Things are improving. We have to go and defend our budget. That is not even enough, but we are going to defend it and get as much money as we can. And we'll continue partnering with all the private sector people here, because without private sector, trust me, our people will not be able to get the best care that is possible. And once again, I do recognize that health is a business. And I think when we look at it that way, we know we have to make money. And people will only go to places that are good, that people have told them are good. And it includes customer service. And that is something that money doesn't buy. Because if you go somewhere and the customer service is crap, you're not going to go back there again. And people complain a lot about hospitals. We're doing a lot of training on that in public hospitals. So that people can come to our facilities. We're doing a lot of infrastructure. Most of our hospitals are not purpose-built. They're either old secretariats of local governments, and then they handed it over to us, and then it became hospitals. So sometimes when you go there, there's even no processing. You go from ER to this place to this. So it's not convenient. It's not patient-centered. It's not patient-focused enough. And that is where we're changing a lot of things. So well done for this. We'll read it, and we'll be in touch. Congratulations to BusinessDay, and congratulations to you, Dr. Olugbile. Well done. Thank you.
Thank you very much. I believe we can have another round of applause for her. Thank you. All right, and to deliver the final goodwill message, please let's welcome the Chief Medical Director of Lagos State University Teaching Hospital, Professor Adetokunbo O. Fabanwo. A round of applause. Let's make the applause louder. Thank you very much.
Good girl. Distinguished ladies and gentlemen, to be nice to stand on protocol, but to be the height of disrespect not to acknowledge our Egbon. As a proper Ijebu boy, I must acknowledge the Ogbeni Oja of Ijebu land, Dr. Sonny Kuku. I'd like to greet all of you. I'd like to say that this is an epoch-making event. Dr. Olugbile, Femi Olugbile, and I have a lot in common. We've come a long way, as far back as 59 years ago. Small schoolboys in Government College Ibadan. And I'd like to tell a little story about writing, which you will find very amusing. Sometime, I think in 1969 or so, we dared each other about who could write better. and we challenged each other to write pieces. And we showed it to a senior of ours to assess, because at that time, he wrote very well. We all knew that he was excellent with the English language, and he wrote very well. But I also believed that I wrote very well as well. So we challenged each other, and the senior cleverly delivered a verdict of no victor, no vanquished. Your pieces are both good. That was what he said. So I want to congratulate you, Femi, for putting this together. I'd like to thank Frank Agbogo of BusinessDay for giving him the platform to do this. I was part of this because our facility was asked to answer questionnaires and fill forms about what we do. I'd like to say that the perspective of high-quality medical care coming up in the private sector is good, is excellent, is a welcome development. But my own position is that the public facilities must not be ignored. Because the public facilities will still be able to offer advanced services to the citizens at affordable cost. In Lassoth, what our strategy had always been to partner with high net worth individuals and corporate organizations to have public-private partnerships. And in those PPP agreements, we insist that the costing or the determination of fees to the patients must be in accordance with the philosophy of public health institution. They must be affordable. So quite a number of them end up giving us long years of tenureship for the PPPs, which is okay, for as long as we can keep the cost affordable to the citizens. So, like Dr. Oguyemi said, I also look forward to reading the complete document. I'm sure it will be a very exciting read. I wish all of us a very exciting afternoon or morning. And Femi, I wish you well now and always. Thank you.
Ladies and gentlemen, another round of applause for him. Thank you very much, sir. Now we're going to be moving to the unveiling and presentation of the report, but just before we go into that, I'd like to recognize the presence of the Director of Nursing Services in Lagos State, Mrs. Akinre Shonibare. A round of applause. You're most welcome, ma'am. All right, to do the unveiling of the report for us, I have the honor to welcome Dr. Sonny Folorunsho to please unveil the report and also say a few words. Sonny, okay. Dr. Sonny Folorunsho to do the unveiling and also say a few words regarding the report, after which every distinguished guest on the high table would also come forward to take pictures. Please, a round of applause for him. Okay, all right, please, ladies and gentlemen, let's come forward. Yes, sir.
I was going to do that.
Okay.
indeed my pleasure and an honor for me to unveil this book, which in the end is going to start the beginning of health care, quality health care. Because after some time, we hope that people are going to be struggling to get into this kind of book. And competition begets excellence. So on behalf of our author and BusinessDay, I unveil this book and recommend the book to everybody in Nigeria and elsewhere as a compliment. Thank you very much. I will do the needful because nothing comes for nothing. I shall go to the Oja and meet all the market women to come and contribute to this. But I'm sure that it's going to be worth every penny we spend. And we'll take a number of books to spread around so people can start understanding how these hospitals start and what they're about. Thank you very much. You see, Mrs. Okuyemi is here, and she works for Lagos State FIRS. Oh, sorry, no, she's special advisor. They are spies. This is Lagos State people. How much is the budget? 10 trillion. Thank you very much.
Thank you so much.
Every year I get this video.
All right, thank you very much, ladies and gentlemen. Another round of applause, please. Thank you. Please let's note that copies of the book are available for sale. A copy is just 17,500 naira. So if you are interested in getting the book, please, you will be able to get it immediately. 17,500 naira per copy. Thank you. We will now be moving into the panel session, and we're going to be discussing the journey to world-class healthcare and universal healthcare in Nigeria. The question today is, are we on course? And of course, I have the honor to introduce our panelists. The first panelist here, please welcome the Managing Director of St. Nicholas Hospital, Dr. Dakpo Majekodumi. A round of applause for him, ladies and gentlemen. Thank you. We also have, to join him, the CEO of Marcel Ruth Cancer Center and Specialist Hospital, Dr. Modukpe Elebute Odunsin. A round of applause. Thank you. And of course, on the panel session, we also have the Director of NSIA Luth Cancer Center, Dr. Lillian Ekpo. A round of applause, ladies and gentlemen. And to moderate this panel, we have the Senior Health Correspondent at BusinessDay, Mrs. Temitayo Oladehinde. A round of applause, ladies and gentlemen. Please, we can make the applause louder than that. Thank you.
Again, thank you very much for showing up today. These are very, very busy CEOs and heads of healthcare in Nigeria. And I mean, having them in the same room this morning is something we do not take for granted. But for this panel session, and for me, it really brings to light something very crucial. We are talking about journey to world-class healthcare and journey to world-class healthcare, leveraging UHC. And then again, we are talking about, are we on course? the first answer on my mind is with these people on the panel, we are on course, but on a whole, looking at it holistically, are we really on course in Nigeria? So that question will first go to Mrs. Lillian Epo. She is the director of the NSIA Lute Cancer Center, one of the epoch-making hospitals currently in Lagos that is helping with cancer care in the country. What do you think, Ma? Do you think we're on course?
Thank you very much for that question. It's a pleasure to be here at this kind of forum where we're discussing the advancements that have come with healthcare recently in the country, which Dr. Lubile has so, very accurately chronicled. So I would say, to answer the question, I would say yes, we are close. We are making progress. I would say we're close. We're making progress. And the progress we've made is on the supply side. And by that I mean, we have all these facilities. We have the, equipment coming in. We have cancer centers springing up. I mean, on the panel, you already have CEOs of 2 cancer centers. 5-10 years ago, you wouldn't even find any functional cancer center. Now, that, story is a tale of the past. But on the demand side, which is, can people pay for these services? Exactly. That's where the problem is. So that's where the gap is, and that's what we need to close. So in that wise, in that area, we are not close. And it's a combination of the two. The equipment, the resources, the people to, because machines don't run themselves. You need the technical expertise. We all are familiar with the jackpot syndrome, and what Lagos State government is doing a great job with the jackpot, are getting more people to come back, to bring in their expertise and stuff to help the system. But the main thing is getting that coverage. And it's fantastic that Lagos State government is, taking the lead, as they always do in a number of things in the country, with Ilera Eco, to see what can we do as regards, the payer aspect for healthcare. Because somebody always has to pay. There is no system anywhere in the world that it is entirely free. There's somebody that's paying. It's either government or the, the end user of the healthcare service itself.
Thank you, Dr. Lillian. Now, Dr. Omaje Kudumi. So we are talking of world-class healthcare provision. So I'm imagining I will be getting the quality of what I get in New York or in UK, in Nigeria. But when you talk of that world-class healthcare provision, does it really go along with universal healthcare? Does everyone get to access it really when we are really talking about world-class healthcare?
Thank you for inviting me, but no, I'm not thanking you for inviting me here because I'm not. This panel thing is new to me. World-class healthcare. Yes, I don't see why you can't have world-class healthcare at a lower level. Lower, when I say lower, I don't mean lower people, I mean lower quality, lower level of medical care. So it's primary healthcare, secondary healthcare, tertiary healthcare, quaternary healthcare. So you can have world-class healthcare at the primary level as well. It doesn't mean, but I think as some of the other speakers have said earlier on, is funding. I think that's the major problem we have. How do you pay for healthcare? Healthcare is expensive. And to me, I think actually what we should try and look at as well is preventing people from having to go to tertiary level, catching things early. Prevention, I think, is better than cure. So if we can do, it's cheaper. If we can do more healthcare centers, in the system which where I trained, you have your GP. So everybody goes to a GP, and the GP refers you to a specialist. But I find that here, I have people calling me and say, I want to see a pediatric, I don't know, and yes. How do you know that's who you want to see? So you should go to the first level, to build, 3 levels or however many levels of it of healthcare, and have the same quality at each level. And I think that's another thing that maybe we should concentrate. I think Lagos State is doing that, where you're having quality standards. Some hospitals here have COSASA, some have JCI. We also have Safe Care. So all the primary all the millions of hospitals should have a standard they have to keep up to. We're too emotional. I mean, we have some horror stories of people who come to the hospital and they've been completely messed up by somebody. But that's it. You don't know, nothing happens. It's just the end of that. And so there should be some level of oversight, and which will come from the government to make sure people are getting. So yes, you will have quality health care at each level of care.
Okay.
Okay.
Thank you very much, sir. Now to Dr. Elebute Odusi of Marcel Root. I really want to ask you, from your experience as a strong private sector player in the healthcare sector, what more do you think the private sector can be doing, and how can the government support you to really drive the quality of healthcare that we desire?
Okay, thank you very much, and thank you for having me, and to Dr. Olugbele and Mrs. Olugbele, because behind every successful man, fantastic work. We're very, very, very impressed and looking forward to turning the pages. First of all, I would like to just say that, this is about healthcare in Nigeria, right? This is not just healthcare in Lagos. I know we all think about Lagos. And I will say, and I'm going to actually, that even for me, until very recently, I only thought about healthcare in Lagos or in the urban, or Abuja, for example, or in the urban cities. Now, very recently, I have had the privilege of sitting on 2 national committees for health, one on cancer control for the whole country, together with WHO and IAEA. And recently, I had the opportunity to travel around the country with the WHO IAEA group. I mean, honestly, my eyes have really seriously opened to what healthcare is like in the country. Once you leave the cities, it's a totally different picture altogether. Some, as you would expect, but some actually in tertiary hospitals that we all know well, and you'd expect things to be running very well, but you go there and, for example, the pharmacy has no drugs. In big teaching hospitals, and patients are having to go and buy drugs from across the road from a pharmacy who's maybe not regulated, I'm not even sure. And obviously in my world, chemotherapy drugs are supposed to go through a particular cold chain, and we don't know whether it's been through that cold chain, and we're giving this drug to patients. But on the other side, I also saw some remarkable places, like I think what Dr. Olugbele was trying to highlight, and I'm sure has highlighted in his book, some federal medical centers. We went to Ibadan, Sokoto, around Abuja, Lagos, across, and honestly, you'll be surprised what you see in some of these places. And I think we need to sort of also pay our respects to those institutions, because as we all know, there is no ease of doing business in Nigeria. That's the bottom line. Whether from the supply side or the demand side, I'm not a business person in that way. I've learned a lot since we came back to set up Marcel Root 4 or 5 years ago. But I will say that it's been extremely, extremely exciting. It's been really tough. I've learned a lot. I've been through a lot. But in these 4 years, to have been able to see close to 6,000 patients coming from across the country, and now coming from West African countries, to Marcel Root, now being able to participate, having been given accreditation to run a residency program in oncology, as well as other specialties. This is where things can happen, things can move, and I think we are all in a very interesting position right now to really drive healthcare forward, not just in Lagos, but I think throughout the country, to be honest. And I do think that specialty-driven medicine, which is what is happening across the world, and which has come to Lagos in different ways, as fully funded by ourselves. Not an easy task, but we've done it and we're doing it. Some through PPPs, and some government, and the governments are moving in lots of different directions. But I think, honestly, where healthcare was, and all credit to Ogbeni Oja, to people like my late father and late Dr. Maja Kudumi and so on. When they started this sort of project, nobody believed that they were actually going to be sustainable. But actually, most of them have grown. St. Nicholas, it was on Lagoon, and then on 5-6 different sites now. I'm hoping and praying that, yes, we need the funds, that's for sure. There's lots of discussions about national health coverage, and I think somebody alluded to Rwanda. But I wanted to explain, because we were actually in Rwanda last week or so. We went to the Ministers of Health Summit, which was really exciting. I mean, it's across Africa. There were 15 or so ministers for health or their deputies at this meeting. It was incredible, saying what we're saying. But the population size Nigeria is in a different place from all these places. They have 9 million people in their countries. But and people will say Rwanda is covered by universal health coverage. Actually, the people know, and also the payments, they pay $3 a year. That's all they pay. So although they're saying is universal health coverage, the people only have to pay $3. But the country, because the president has the commitment to ensure that people get access to care. That's what it is. It's the political will and driving it from either taxation or from other opportunities from government to say that, for every patient having this treatment, we're going to contribute this amount of money. That's the only way that it's going to be done. You can't say you're going to wait until people can afford to pay the amount of money that they need to pay in insurance, because most people can't afford it anyway. So it has to be the political will to help healthcare be sustainable. Amazing healthcare has come to Nigeria in lots of states in the country. There's the spinal center in the east. There is the neurosurgical center in Imo. There are all sorts of incredible people who have come back to do this. My plea is that the government does look at this book, use it to, even if that's the beginning of it, because most of us are struggling. I mean, I'm not going to, electricity, our electricity bill went from 3 to 5 million every month one day to 13 to 17 million the next day. We cannot pass those costs to our patients. So the support is going to be needed. But I do think that we're in a very, very exciting place, and I'm glad to be here. Thank you.
Thank you so much for that insight, Dr. Olebute. Thank you. In closing, Dr. Lillian Epo, what would be your closing remark? One of the things highlighted in the book is that many of the fantastic modern healthcare hospitals we have in Nigeria are clustered in cities. Yes, this clustering, I know NSIA is trying to decluster. Some 6 cancer centers are expected. How is this going, and what should we expect in closing?
Thank you. So yes, let me just clarify. The 6 cancer centers in the different geopolitical zones is a Federal Ministry of Health project. It's been specially project managed by the NSIA, since we have demonstrated with the cancer center in Lagos, successfully demonstrated a proof of concept. So that project is actually a Federal Ministry of Health project. The NSIA on its own will, through its healthcare arm, MedServ, is going to roll out 2 additional cancer centers, in addition to the one in Lagos. So all of that is going well. We've done groundbreaking on a number of locations. We've looked at floor plans. All of that is being rolled out well. We're currently, equipment procuring is ongoing, training of staff is ongoing, and like Dr. Olebute has said, very exciting times. We all know the statistics as regards cancer, and, generally, globally, incidence of cancer is on the rise. It's going to be worse in LMICs. Incidence will double by 2050. And I love to say this is one time the Nigerian government is putting its money where its mouth is. And they're actually committing to increasing the infrastructure, increasing the, personnel training and all of that funding to actually tackle this problem head on. So yes, Dr. Liberty had mentioned political will. Yeah, there's still a lot to be done. It's like when you have a system that had decayed for so long, even when you are making progress, it looks like you're standing on one spot. And Nigerians actually do love to self-flagellate. I say Nigerians because I'm a Nigerian myself. We love to look at our system and we say what doesn't work in every single way. How terrible this is, how terrible that is. But I always love in any time, any forum I'm in where I'm given the opportunity to speak about Nigerian healthcare, I like us to take a moment and think and say, like Professor Elebisi has said, look at all the advancements in neurosurgery hospitals, all those things. You go to the UK, I mean, I've had someone who was chatting with an old school friend who said, oh, she wanted to do a scan. She had heavy bleeding. I think in Nigeria, at some point, she'd been told she had fibroids many years ago, and then recently was saying, okay, she needed to do another scan because the bleeding was really bad and was affecting her, lifestyle and well-being. And she said, oh, she was waiting for a while. And I didn't know where she was when I was having this conversation because she lives in Nigeria. So I said, if you're waiting for a scan, you can't be in Nigeria. You must be in the UK if you're waiting for a scan. And she said, yes. I said, come home, you get a scan in 2 minutes. Why are you sitting in another man's country and you're taking forever to get a scan? So those things that you can do in Nigeria, I've had, I think it was early this year, I think it was late last year. I have a 4-year-old. When he was 3, he was playing with me. My glasses were off, and he gave me a corneal laceration. I didn't realize my cornea was lacerated. I just thought, he stuck his finger in my eye and the pain would go. But by the next day, looked in my eye, it was red, of course it was swollen and all of that. And I was chatting with a friend and I took a picture of my eye, friend in medical school, she lives in Chicago. And I said, oh, I think my cornea has been lacerated. Jordan, that's my son, stuck his finger in my eye. She said, oh, and I said, that happened on Friday night. And I said, it happened on, I think, Friday morning. So this is us chatting Friday night now, this my Nigerian time. And I'm saying to her, oh, I think I need to get to an ophthalmologist. And she says, get to an ophthalmologist on a Saturday. And I say, yes, why would I get to an ophthalmologist on Saturday? I have a corneal laceration. Am I supposed to carry my eye like this till Monday morning? And she says, in Chicago, nobody is going to touch your eye. No ophthalmologist is going to be open on a Saturday morning. The most you do, you go to ER, and they give you something for the pain, and you're going to take that eye like that till Monday. And I said, you've got to be joking. I said, there are multiple ophthalmologists open today. And I went from one, I think that day rained heavily, so they were a bit late, and I was in so much pain. I said, no, this was wasting my time. I drove down to another place, and I had my eyes sorted, everything that single day. So there's so many benefits in this environment that we do not realize. Yes, there are negative stories, there are things that are not working right. And that's why one of my commitments and the commitment of the NSI Youth Cancer Center is to, I always tell people when I have the chance to do, I'm a corporate storyteller. I tell the stories, success stories of treatment, of things that are done that are successful, because everybody hears the negative. Everybody hears the thing that doesn't work. The patient that wasn't, treated well and died. This that didn't happen. When they were doing the surgery and they took the light. But they don't tell all the success stories of, people that were treated in Nigeria and they got better. We don't hype ourselves. Americans hype themselves. We never hype ourselves in this country, and there's a lot of good work that's going on. And like Professor Lebute said, Dr. Lebute said, it's an exciting time to be in healthcare in this country.
Thank you so much for that. It's sounding close. Dr. Majikuzumi, I'm coming to you in closing. What is St. Nicholas doing in driving us towards a world-class healthcare system? I mean, you've done a lot already, but please update us.
I think we're trying to get renal transplants to be done every week, all the time. That's basically it, I think, trying to domesticate. And we've been doing renal transplants now. When we were in Kigali, I said 15 years. It's actually 25 years. Yeah, so it's been going on for 25 years now. So I think we need to, but we have a doctor that comes from India, a doctor that comes from the UK, but now we have a doctor that comes from Kano. I can't remember his name now, so he comes from Kano and does the transplants. So the idea is to have it done like a regular, shouldn't be a big deal. It's something that you just do regularly. So we're also looking at other transplantation, but for now, we'll just talk about renal transplants. Thank you.
Yeah, and now to Dr. Lebute. Finally, in just 30 seconds, what's your hope about the future of healthcare in Nigeria?
I thought you were going to ask me the same question, so my brain was there. And I'm going to, sorry, let me just quickly say, that, one of the things that I think we need to understand about looking after our own patients here in Nigeria is that we, on the healthcare side, we're very passionate about our patients. Having worked in the UK, in the NHS, into top teaching hospitals, seeing Nigerian patients come there, and the difference with treating patients at home, apart from the fact that they're able to be in their own homes, they're able to stay at work and have outpatient treatment and so on, we go the extra mile for our patients. And it's important to say this, just like Dr. Eko was saying, that there's all the negative, and I'm sure there was, because I wasn't here for many years, although I used to come and do some work in Lagoon over a period of time, but I was shocked when I came back to understand the mistrust in the healthcare system by our patients. It's been a real eye-opener for me. And it's not just on the side of people feeling that they can't get the right care, because as we're saying, there's been a lot of change, okay? There is change, there's definitely change, and it's not just the infrastructure. They're very well-trained doctors. I mean, Nigerian doctors everywhere in the world are phenomenally trained people, and I digressed back to that Rwanda story, but we went to visit a hospital in Kigali when we were there together as a group, and one of the things that they're doing there is that as they're improving their infrastructure, they're training. So they call it the 4x4 program. They're sending 4 doctors away, or health. So those are the ones who are going to come and head the departments when they come back. But one thing that they're doing, which I'd never thought about before, is that they're also sending 4 people in, experts in. Because what happens here is that you get these top people coming who have all the knowledge, all the expertise, all the training, but the people they're coming to work with are not really up to standard. So by this 4x4, the 4 people go away, and whilst they're being trained, the 4 people are here to train the rest of the cadre of the team. How phenomenal is that going to be when that person comes back and starts to run that place, okay? But we go the extra mile for our patients. I'm going to say this so many times, and I'm going to illustrate it with one thing. For example, radiotherapy is only delivered Monday to Friday anywhere in the world, okay? But we have had a number of patients, and particularly prostate cancer patients, where they're having cord compression, imminent cord compression, where they will be paralyzed, arriving to us from wherever it was, on a Friday afternoon or what, my team will come in and treat them on Saturday and Sunday. They don't ask for an extra, because there are people, right? We see that, oh my gosh, this guy, we cannot afford for them to be paralyzed. So the winds have changed, is the point I want to make here. We have got the expertise now, and we're training. Those of us in the field, we're doing so much to continue the training and capacity building. And we're trying to provide, it's not easy, the systems are not easy, but we're doing our best. And we're not perfect, but we are doing our best to try and provide international standards of care here. And we're going that extra mile for our patients. We hear it time after time. The problem we also have, though, and the reason why I'm saying this, is that the patients will come, you will have gone out of your way, you will keep that radiotherapy machine on at the weekend, you will treat them. The following weekend, they go back to England to go and check whether what you have done is right. And then, by the way, when you present your bill in Naira, which is nothing like what, for example, radiotherapy for prostate cancer is £35,000 in the UK, at our centers is the equivalent of £1,000. But they will still go and check, and then when you give them your bill, there will be long discussion about why this bill is too high, why the bill is too high. Do you understand what I'm trying to say? So please, with this forum, and I'm this pleased to Dr. Olugbele as well, in your next iteration of this, to try and educate the public about the fact that we need to have excellent standards of health. If COVID did not teach us anything, all of us in this room, is that you may not be able to get on that plane out of Mauritania, Mohammed, and it happened to a number of people. So please, let us applaud ourselves for the fact that good, excellent healthcare is here, coming, growing with the new Medipark and so on, and lots of places across the country. But please let the population respect that, and also respect the fact that those of us who are delivering the healthcare are delivering it at a cost. There's a business of doing healthcare, and we're not going to survive if we don't actually get paid for the work that we're doing.
Thank you so much, ma. Thank you to all our panelists. It's been wonderful having you. Thank you.
Ladies and gentlemen, please another round of applause for our guests and our panelists. That was really groundbreaking and insightful. If you'd like to purchase a copy of the report, you can find the details on the screen. A copy costs 17,500 naira. And of course, you can transfer to any of the account details that are there. But please, do we have anybody with any questions? Say questions for the panelists. Does anybody have a question for any of our panelists very quickly? Or questions, okay. Or questions on how to purchase as well. But we have a question and we'll take that very quickly. All right, but before we take that question, does anybody have questions on how to purchase a copy of the book? In case you would like, to reach out to a member of the team, this is his phone number, 081-2024-3167. If you just take that down very quickly so that you don't forget, in case of another day, I'm going to call it again, 081-2024-3167. Mr. Shegun of BusinessDay to purchase a copy. But if you'd like to do that now, the details are on the screen. Okay, the phone number is also on the screen. If you'd like to also copy that from there. But I just take it again, 081-2024-3167. A copy of the Frontline Health Facilities in Nigeria. So while we were having the panel session, we also had another guest join us, the CMD of FMC, Ebute Meta, Dr. Adedamola Dada. Please a round of applause for him, ladies and gentlemen. Thank you. He's just right at the back. Thank you very much, sir, for joining us. So we're nearing the end of the event, but just before we end very quickly, we have another important announcement about a groundbreaking book that was published also by BusinessDay. To do a bit of an introduction of the book, I will welcome the editor, the Sunday editor at BusinessDay, Mr. Zebulon, to give us a brief of the book. Please a round of applause for him, ladies and gentlemen.
Thank you, ladies and gentlemen. We appreciate your coming here this morning. But before we dash out of the room, as our compere has said, there's an important book we also need to bring to your attention. I know that health experts, they know the role laughter plays in the life of every human being. Laughter. And the economic, socio-economic and political situation in the country has brought a lot of stress on many citizens. In BusinessDay, we have one of the best cartoonists, Mike Asuko. I know you must have heard about that name. If you have heard about Mike Asuko, can I see your hand up, please? Mike Asuko is gifted, arguably one of the best cartoonists across the country. And he has carefully put together certain cartoons that will make you laugh, and you will relieve the stress. Whoever that is the cartoons here will have no business with hypertension. I guarantee you that. So many people have read, and they are coming to tell the good stories about what the cartoons Asuko crafted has done in their lives. And I can say you are privileged today to be in the room where we are presenting this book. These are freshly minted cartoon books. So this paperback is just going for 50,000. Paperback cartoon contains a whole lot of cartoons that will make your blood pressure to go down drastically, and you will laugh and laugh and laugh. We have a soft back that is 40,500. Please do not leave here today without a copy of either of these two books. Please, if you're interested either in looking at the books, let me come your way so that you have a look at the books before. I'm not saying pick it. If you are not ready for it, just look at the book and see what we have on the offer. Just look at it. Sorry. Okay.
All right, thank you very much, ladies and gentlemen. Thank you so much, Mr. Zebulon. I'm sure that once they look at the book, they would understand the need to invest in such very interesting cartoon book. Ladies and gentlemen, thank you very much for your time. To take the closing remarks, once again, I'm going to welcome the publisher of BusinessDay. Please, with a round of applause, let's welcome Mr. Frank Aibogun.
Thank you very much. We probably have overstayed our time, so there isn't any more time. I know that you have come out of very busy schedules and you need to go back. We emphasize, of course, healthcare, but we emphasize sustainable healthcare. If you are not there in the facility, a lot can go wrong, you know. So we don't want to keep you for a whole day. There isn't a need to do that anyway, and this place is a bit warmer than it should be. Let me thank all of you for coming and for associating with the brilliant work done by a brilliant psychiatrist and essayist, Dr. Femi Olubile. You will see that in reading the book, you would have ideas. Let us share your ideas with us or share them with Dr. Olubile, so that as we prepare for the next edition, we would have more information, more perspectives to introduce or infuse into the book. But I hope you've had a great time. Our ultimate desire is to engage more closely with the medical healthcare services sector, to be able to understand what the needs are and how, as a media company, we can help to push the same objectives for Nigeria. Once again, distinguished doctors, professors, ladies and gentlemen, chief medical directors of health facilities, we are profoundly grateful for your ability to join us today. I wish you a wonderful Christmas and a great New Year. God bless you all, and bye-bye.